Welcome back to this channel. In this video, we will talk about intermittent fasting. What is exactly the intermittent fasting? What are the different types of intermittent fasting? What are the different fruitful benefits of it? And who should avoid the intermittent fasting? So stay tuned till the end of this video. We'll discover the fascinating science behind this intermittent fasting. So what is intermittent fasting? See, intermittent fasting is nothing but the eating pattern cycling between the periods of eating and fasting. It's not about what you should eat, but it's all about when you should eat. It's about the time constraints that will be implied on you for the eating purpose. Means you can virtually eat anything in this intermittent fasting, but there is a time restriction. Means you can eat during a particular period and you have to fast for a particular period. See, means therefore it is, if you see its definition or concept of intermittent fasting is an eating pattern cycling between the periods of eating and fasting. It focuses on what, when to eat rather than what to eat. Means it's all about defining yourself or constraining yourself within a particular time span for the eating purpose. Okay, so it's nothing but the daily time restricted eating and periodic fast. So this is the concept of intermittent fasting, where you have to fast for a particular period of time and you have to eat in a particular period of time, that is termed as eating window. It might be some few hours long, that we will see in next slide, where we are seeing the types of intermittent fasting. So it will be get more clear to you. So what are the different types of intermittent fasting? See, there are basically three different types of intermittent fasting. First one is 16 to 8 method. Second is 24 hours fast method. And third one is 5 to 2 diet. So these are three popular intermittent fasting method. But out of 8, 16 to 8 method is quite popular method and it's recommended for beginner. Okay. So what is this 16 to 8 method of intermittent fasting? See, you have to fast for 16 hours a day and you have to eat during the 8 hours window. Means in total we are all are having 24 hours. Out of that 24 hours, we have to fast for 16 hours and we have to eat during the 8 hours window. Let us take one example. If you finish your dinner at 8 p.m. in the evening, so you should close your eyes, you should zip your mouth, and you should not eat for next 16 hours, which will include your sleep also. So in next day at 12 p.m. you are eligible for eating. Means 8 to 8, 8 p.m. to 8 a.m. 12 hours and 8 a.m. to 12 p.m. 4 hours. So in total you have fasted for 16 hours. Okay. So during that period you can take a 0 calorie drink like green tea or a black tea without sugar. Such drinks are allowed because they are not getting any calories. So during that period, you can take that green tea, plain green tea without any sugar, without any other ingredients. So this will continue your fast for 16 hours, and from 12 p.m. afternoon up to the 8 p.m. in the evening, you can eat anything. So this is your eating window where you can eat anything during this period. But again, once you have finished your dinner at 8 p.m., you should stop eating and start fasting. So this is the first method. Second method is 24 hours fast. So what you have to do is you have to fast once or twice in a week for 24 hours. Means if you completed your dinner at 8 p.m., you should fast for 24 hours and you should you are having next meal at 8 p.m. in the next day. Means for 24 hours you don't have to eat anything. It quite seem very difficult for us. It's not that much popular as compared to 16 is to 8 method. 16 is to 8 method is quite popular and it is beginner friendly. Means most of your time is goes into the sleeps where you don't feel any kind of hungriness in you, so the period is passed smoothly. But during this 24 hours fast, it's quite cumbersome to have don't have anything for 24 hours, so this is quite difficult. Third one is 5 to 2 diet. Here what we have to do is we have to eat normally for 5 days a week, and for rest of the 2 days we have to restrict the calories for up to 500 to 600 calories on 2 non-consecutive days. Means non-consecutive days means you should between these 2 days you should have 1 or 2 day gap of eating, and after that you have to restrict the calories for that particular days. So these are the three different types of intermittent fasting, but out of that 16:8 method is quite popular. Let's move to the next slide where we'll see the fascinating health benefits of the intermittent fasting. See, in the current era, you are getting diseases very quickly. Your body is prone to various disorders, diseases. Our food habits are not that good. So therefore, it is attracting different types of diseases. So to prevent that, intermittent fasting might be your solution for one-stop solution for all of these things where you can live a healthy lifestyle. Okay, so what are the different benefits? The first and foremost benefit is fat loss. Fat loss, sorry. Fat loss means what? Basically, fat obesity problem, fat problem is quite common these days due to wrong food habits. We have accumulated the too much fat in our body, and which is very difficult to melt. So during intermittent fasting, what happens? In intermittent fasting, it shifts the metabolism from glycogen to the fat. Okay, means if you fast for 16 hours, so first 6 to 8 hours, whatever the reserved glycogen, the form of carbohydrate which is present in your body is continuously consumed. Once the glycogen is depleted, body shifts its target from glycogen to the fat after 8 to 12 hours of eating. So after 12 hours, it is completely shifted towards the fat. So your fat got broken down to get the energy because we have fasted for so long. So there is no any reserve food material in the form of glycogen in the body, and therefore body shifts the metabolism towards the fat. So it will help in reducing the fat to a very great extent. Second thing is, indirectly it will help in the weight loss also, fat loss, weight loss. So second is insulin sensitivity. Okay, we know in these days diabetes mellitus, in particular type 2 diabetes, where the insulin is secreted. There are two types of diabetes, type 1 and type 2. In type 1, insulin is not at all produced by the body, whereas in type 2 diabetes, insulin is produced in the body, but the sensitivity of insulin is hampered. Insulin becomes insensitive, so that it is not able to function properly. In that case, the diabetes mellitus type 2 happens, and in this case this intermittent fasting is very much beneficial. What happens in this? Insulin sensitivity is restored through the intermittent fasting, because in this, if we are fasting, then we are not eating anything, and the rule of insulin secretion is that whatever you eat, the baseline secretion of insulin occurs. Means if even if you use one toffee, one bite of some anything, the baseline secretion of insulin happens. At so many times you eat, at that times insulin secretion happens. Means if you tie 8, if you put anything for 10 times, the 10 times insulin secretion occurs, and because of which the insulin sensitivity slowly decreases. Means your body wants more and more insulin to get that sugar back into the cell, same sugar back into the cell. Means more and more insulin is required to get back that blood sugar into the cell, so insulin becomes insensitive. Okay, so here if you are not eating for anything for 16 hours or fasting for a longer period, then insulin is not secreted, and therefore which regains the insulin sensitivity. Then third one is cellular repair. So this is again one of the major benefit. Well, there is one concept, autophagy. Autophagy means what? Our cell eats our own cells. But which cells? The cells which are aged, which are diseased, which are not functional, that cells get eaten by the healthy cells because the cells are starving. They're not getting any food. So because of that, auto means self, phagy means to eat. Self-eating, literally autophagy means what? Self-eating. So the diseased cell, aged cells, and in some cases, cancerous cells are also being eaten by the normal cells, which will prevent the risk of cancer to very large extent. For this autophagy concept, the Nobel Prize is being awarded. So it's a proven fact, and it has indirect link with the cancer preventions. So your intermittent fasting might indirectly prevent the cancers, because even if your cells are having cancerous cells in it, the in early stages it is being eaten by the healthy cells, the cancer will not spread off. So indirectly, autophagy helps in prevention of cancer. Even though direct link between autophagy and cancer is not established, but indirectly, yes, surely it can prevent the cancers. And last benefit is what? There are many other benefits also. The last benefit is heart health. So it lowers the blood pressure and it reduces the inflammation markers. So inflammation is prevented, and it also helps in lowering the blood pressure. So these are most of the benefits of intermittent fasting. So moving to the next slide, who should avoid the intermittent fasting? So before starting this, you should always consult with your healthcare professionals, so that your body is different. So according to that, whether intermittent fasting suits you or not, that is being also being watched. So who should avoid? First, pregnant and breastfeeding women should avoid this intermittent fasting, because they are having more nutritional needs. So they will not be able to get the nutrition if they fast for so long. So they should avoid the intermittent fasting. Second, individuals with history of eating disorders. Individuals are should be avoided, who are having eating disorders. That people should not follow the intermittent fasting. The people with diabetes or blood sugar regulation issues. If you are already having diabetes, then you should consult your doctors before starting the intermittent fasting. So to avoid the you can say hazardous or side effects, or you can say to avoid the harmful effects of it, because your body will not directly adapt to that. So you should always consult. If you are having diabetes, you should consult with the doctors. Then the people with chronic illnesses, that should avoid this intermittent fasting. And the people with or the children's or adolescents who are also having the increased energy demand, they should avoid the intermittent fasting. Finally, final verdict or a takeaway from intermittent fasting. Intermittent fasting is not a diet plan, friends. It is a lifestyle choice. Means you have to continue it for a lifetime. Okay. It is the flexible, evidence-based backed approach to improve metabolic health and support weight management. Means your weight is maintained, your metabolic health is maintained, all things will be in control. So for that, what you should do, you should choose right fasting type for your lifestyle. Then during your eating window, you should avoid eating junk food. So you should take balanced nutrition in your eating windows. And as I told you that you should, before starting, you should consult with your healthcare professionals. And finally, last but not the least, view intermittent fasting as a sustainable health tool. Sustainable health tool means what? You should able to practice it for a lifetime, not a quick fix. Means you are following the intermittent fasting for 3 months, you get your weight loss, and you should start eating again. So this is not done. You have to follow it for lifetime. You have to make it lifestyle. Okay. So I told you all the health benefits of intermittent fasting. What are the different types of intermittent fasting, and who should avoid the intermittent fasting. And I hope you all will get understood what is exactly the intermittent fasting. If you have any query regarding intermittent fasting, you can put in the comments. I will answer those queries. And if you like this video, please hit the like button and share it to the friends. Thank you. Thank you very much.